In Alberta, 1 in 2 people will develop cancer in their lifetime. From the year 2000 to the year 2019, the annual number of people in the province who have been diagnosed with cancer has increased by 85%. For 2019, over half of all these cancer cases are represented by only 4 types of cancer: breast, prostate, colorectal, and lung cancer. In 2021, we had 6,701 deaths related to cancer in Alberta. Incidence is projected to increase by 23% by 2013 and by 36% in 2040. 2040, almost 34,000 people in Alberta will be diagnosed with cancer. 35% of patients diagnosed with colorectal cancer, so over 1/3 of them, are diagnosed in the hospital. And often they are diagnosed after waiting for some time with symptoms. We don't quite know what explains why so many patients are diagnosed in hospital rather in the community with family physicians. And that seems to be something that we can change. We established a partnership with Unit 83 at the Rocky View Hospital here in Calgary, and then sought and secured funding from ARNet. So this is a qualitative study. We're interviewing patients diagnosed with colorectal cancer in the hospital and individuals closely related to them, like family relatives and close friends. And the purpose really is to understand from their experiences and perspectives how we could do better, how we could better support diagnosis in the community.
I have seen firsthand the devastation that a late diagnosis of colon cancer can cause. You get handed an admission request with a name, age, and diagnosis. You read 42-year-old male, obstructing colon mass. The emergency transfer report notes previously healthy, a few-month history of bloating, indigestion, and dark stool. And finally, you read in their history note, lives with wife and 2 school-age children. I have personally cared for these patients, and it never gets easier. It feels like a punch to your gut every time. There is a helplessness that settles in over the years of seeing the same scenario over and over again to people younger and younger. I had a lot of inaccurate assumptions about nursing research, believing it was only available to those with their masters. It had never occurred to me that this was something that I could be a part of. This partnership with Dr. Anna and the Cancer Strategic Clinical Network is giving me the knowledge, skill, and confidence to get involved. Thank you for your guidance and encouragement. I also want to thank ARNet and all of their supporters, not only financially in funding the research, but also for providing nurses like myself with the opportunity to be heard. Your organization empowers nurses to get involved and gain experience in the very important work of research.